Chemo-induced nausea and vomiting, as known as CINV, is a clinical situation which most of the patients who undergo chemotherapy and targeted therapy face this situation. It is something which is not pleasant, and body goes through so much of pain and suffering because of this situation, and it is an indicator of the fact that body is trying to reject the chemotherapy drug that has come in. While chemotherapy is essential from conventional perspective to address the cancer cells, but it is ultimately and also a foreign body, and body identifies that as a foreign body and does not want to keep it in one's body. The toxicity of chemotherapy is such that it gets mixed with blood, and whenever our body senses the presence of this, there is a specific area at the base of brain which is known as area postrema, or chemo receptor trigger zone, CTZ. Now, why it is important to know about this is because body is trying to protect. As soon as there are chemicals in the body, it wants to expel it out so that it does not create more harm to the body. But that harm may not be as great as the harm it does to the cancer cells. So in one way it is protective, but at the same time has its own adverse impact, and the sequel of this could be that patient gets weaker, dehydrated, not able to eat, etc. So understanding this situation helps. Also, the severity and frequency of nausea and vomiting depends upon how severe or how high the emetogenic profile of chemotherapy drug is. Is it highly emetogenic, moderately emetogenic, or low emetogenic? The profile of the drug, the dose of the drug, and schedule of chemotherapy predicts whether one gets into what type of nausea and vomiting. Again, the types are acute, delayed onset, anticipatory, or breakthrough. Acute is within the administration of a few hours of chemotherapy, patient has vomiting. Delayed is after couple of days. Anticipatory is much before the administration of chemotherapy, which means the previous control is poor and is not optimum. And breakthrough is where, in spite of giving prophylaxis or in spite of giving antiemetic drug, patients develop nausea and vomiting. In such a situation, how Ayurveda can help? Ayurveda can help to identify risk prediction for developing nausea and vomiting. Individuals with low Agni, high Kapha, high Pitta and Vayu in the system, with poor digestion, constipation, an anxious state of mind, older adults, many of such patients are likely to have more chances of developing nausea and vomiting. Can Ayurveda help to treat or prevent? Yes. Ayurveda has range of drugs which works on digestion, which helps to improve gastric emptying. It helps to sensitize the system, reducing the sensitivity to a chemo drug that happens. There are various trials, research publications with plant-based medicine and herbs, which has been proven to have, when a comparative study was done, has shown significant improvement in preventing nausea and vomiting. Also, there are certain external applications, aromatic inhalers, etc., along with the external care, internal medication, various kind of medicated plant-based drinks which can be planned, food can be planned to prevent this. So this situation from an Ayurveda perspective can be very well handled. If you are a patient who is listening to this, please get in touch with the Ayurveda physician who is privileged to treat oncology, who works in an integrative oncology setup, can do this for you. If you are a conventional oncologist who is looking for better solutions for your patients to control CINV, yes, we can discuss, we can collaborate, and we can come up with a framework which helps to prevent and cure chemotherapy induced nausea and vomiting.